we're gonna talk about PRP treatment, and with us Dr. Himmelstain, our medical director. What is PRP?
Okay, PRP is short for platelet-rich plasma. We have different components of our blood, and one component, these little cellets called platelets, are little powerhouses of growth factors. In fact, when you have an injury, the first thing that happens is the platelets clump together, and they initiate a process of repair and healing, and inside these platelets are a number of different growth factors, and these growth factors signal the body to send in the stem cells that will start to produce new tissue. It signals new vessels to grow in, and so what we're able to do with PRP is we take your blood and we separate these little powerhouses, and we use these platelets, and when we inject them at different areas of the body, they release these growth factors, and this is what enables us to stimulate the body to either produce new or better tissue, repair tissue. In the case of what we're going to do today with hair restoration, these growth factors wake up dormant hair follicles, causes new hair growth. The hair that's there now is nourished and thickened. You can even look at this as that these little platelets are packages of tissue fertilizer, let's say.
Okay. So, what areas usually you treat with PRP? Is it just hair, skin?
Well, PRP has lots of applications, but specifically with aesthetics, what we're talking about is your appearance, or your skin, or your hair growth. So we use it in hair restoration. We use it to improve the quality of your skin. We can use it to help build tissue in areas that we want to improve the overall health and vibrancy of the underlying tissue. So we use it to inject into some lines in the face, underneath the eyes. We can use a process called microneedling, where we make little punctures with needles, and the PRP is pushed into these little puncture sites, which kind of turbocharges the body's healing and repair process, and gives you a more robust response to the treatment.
And I know everybody will ask, is there any side effects from this treatment?
Well, there's very little side effects. And you're using platelets, your own blood.
Yeah.
Okay. So I'm basically taking the platelets out of you, and I'm concentrating them and injecting them back in a specific target area. There's really no side.
Cannot be any allergies or anything, because it's just from any like contraindication for people who have some kind of, I don't know, any kind of like health condition that
there's no real contraindications, because again, I'm taking your platelets, and what I'm trying to do is directing your body's healing powers to a specific area by taking these healing elements, these growth elements, and I'm putting them directly on the spot that we want to do this.
Okay. Well, another question is, how many times we have to do this procedure? So what's the recommendation?
Well, in hair restoration, we like to do three treatments a month apart.
And there's some maintenance after that?
There's usually, you get a response, and then you try to keep up with, at least once a year, touch up. If you're doing microneedling, you could, if you do it one time, you get a response. If you do it several times, you get more of a response.
Okay. So is it gonna hurt? Is it painful?
No, it's really not painful. I mean,
so you're gonna use like thin needles?
Yeah, just tiny little needles. I mean, there's, there's some, if we inject into the scalp, there's sometimes a little ouchiness, but nothing that is very painful.
Okay. Well, actually, the next question for me will be, how the person need to be prepared for this treatment. I have showered and my scalp is clean, and what I'm gonna do next? after the treatment? It's something that specific?
Well, after the treatment, we ask you not to disturb the area. We don't want you to rub the area. We don't want you to put on tight hats. We don't want you to shampoo your hair for a
To
day.
be under the sun,
And for a
obviously.
couple of days, we ask you really not to try to disturb it much. But it's there's really not much in the way of aftercare.
Okay, so let's say do not wash the hair at least one day, do
Right.
not touch it, and then everything will be fine. And we're gonna show the steps also, but if you can just shortly tell us what's gonna be the steps.
Well, first I'm going to, take the blood from the arm and put it in a special test tube, and then we put it in a centrifuge, which will spin it around. And as it spins around, the different components of the blood separate. So you have red cells, white cells, and platelets, and that allows us to then harvest the platelets and then re-inject it. And we harvest the platelets with the plasma, so that's the P.R.P. And we use a special product called Cepho, which is...
to even show what's the product we're gonna use, and if you can give us a little bit background for
all P.R.P.
this.
is not created equal, okay? And there's a number of products on the market. I like this product, Cepho,
Okay.
because it has additional step. It acts an activator, and it causes the fibrin, which is a particular protein in the plasma, to start to polymerize or knit together, form what we call a fibrin matrix. This allows the platelets to be kind of trapped in place and allows them to release the growth factors over a longer period of time. We found that as opposed to just using plain P.R.P., by having the growth factors being released for a longer period of time and have a matrix or a framework for scaffolding for the healing process to occur, or for stimulation of the hair follicles, that you get a much better response.
Okay, well that's great. I guess we'll show you next steps. And
Okay, let's go over and
okay,
pick up.
I'm ready.